Everyone has found this session soothing and calming as I did. So we'll now be transitioning back into the conference with a panel discussion with MOTHERLab. With our members Lily Snape, COR Abduhala, and Subecha Durali.
Okay, thank you. Hi, everybody. Good afternoon. I'm so happy to be with you. How are you guys enjoying the conference? Yes? Okay, so what did you guys think about the food? Good choices for lunch? Yes? All right, good. So you guys have to give us feedback on that for the vendors. So I am so proud, honored. Look at my babies. I'm so proud and honored to introduce the MOTHERLab. MOTHERLab stands for Maternal Outcomes for Translational Health Equity Research. So I started MOTHERLab about we're almost 3 years old. Oh my God. 3 years ago in July 2020, at the height of the pandemic, I was giving a lot of talks that spring. I had a lot of talks slated to be given, and then the pandemic happened and everything got moved online. And I kept getting these incredible talent. I was like, I want to support what you're doing. How do I get involved? And so that's where MOTHERLab came from, just the harnessing of this incredible student-led talent. We are really focused on studying the disparities, eliminating disparities in maternal health care for Black and brown women. And MOTHERLab utilizes research, advocacy, and focus on policy and mentorship to really eradicate these inequities by confronting and dismantling the systems that enable and perpetuate racism for Black women who give birth. So today we have a panel of members from the lab to discuss more about their work, and please, they are seasoned presenters by this time. They've done a lot of conferences, and I tell everybody in MOTHERLab we should be ready. This mic, can I try another mic? I tell everybody in MOTHERLab they should be ready to be on CNN at any given time. That's what we're training for here. We're the largest lab in the country, and at any given time, we can and should be ready to respond to the call. So please welcome our amazing panelists, Sawar Abduhala, Subecha Durali, and then Lily Snape. So I'm going to give you guys their bios and be very nice to them in the questions. These are my babies. Okay. Our first panelist is Sawar Abduhala. Sawar is a senior at Tufts studying community health, Arabic, and biology on a pre-medicine track. She is the founder and senior advisor of March, Maternal Advocacy and Research for Community Health. The largest, you're using my language, go girl. The largest undergraduate-led maternal health I trained them. I'm so tickled. The largest undergraduate-led maternal health organization in the United States. Incredible. Yes, thank you. Our next panelist is Lily Snape here in the middle. She's a sophomore. And I have to tell this, I just got to embarrass you for a second. Lily started volunteering for the conference last year as a freshman. I was like, how are you helping run the marketing for the largest conference in the world as a freshman? I couldn't even see straight when I was a freshman, and she's like amazing. So thank you, Lily, for all the marketing stuff. Here at Tufts University, major in community health and child studies and human development with a political science minor. She's from Boston, Mass. She joined MOTHERLab in August 2022 and is currently working as a co-chair of the Marketing Communications Committee for MOTHERLab. So thank you, Lily. And then last but not least, Subecha Durali, my other baby who's about to graduate. I'm not there yet. I can't process because they've been with me since they were like freshmen and sophomore. Like, what do you mean you're graduating? What? What do you mean you want to graduate? I need you here at MOTHERLab. All right, I'm going to try to keep it together. Subecha Durali, a fourth-year undergraduate student attending Tufts University studying community health. Subecha aims to pursue an MD, PhD degree to become a physician scientist involved in public and community health, specifically in reproductive and maternal medicine and research. Please welcome our amazing panel today. Thank you.
Hi, everyone. As Dr. Ao introduced us, we're the MOTHERLab, and we're going to be talking about the Black maternal health crisis in the United States through the lens of the next generation of maternal health scholars. Sorry. Just before we start our presentation, I wanted to frame the Black maternal health crisis in the United States. So if you look at the data on the screen above, this is the data a few of our presenters have been talking about in the last few presentations, but it is the CDC data that came out on maternal mortality that was released a few weeks ago, and it shows a sharp increase between 2020 and 2021 in maternal mortality. Not only is maternal mortality getting worse in general, but the disparities between racial groups are sharply increasing. It was safer to give birth in the United States in 1980 than it is today, and maternal mortality is only becoming a greater epidemic.
Next is showing how the U.S. compares in other high-income industrialized countries according to the Commonwealth Fund. As if you can see, the U.S. has nearly 24 maternal deaths per 100,000 live births, which is more than 3 times the rate of most other high-income countries. And this is very concerning because this is just 2022 data. So the slide we saw before, this rate has increased even further. One of the reasons that this is because I think this, okay, so this slide is, we are just taking that data and we're looking closer at racial groups. And as you can see on the screen, the US Black population has the highest compared to any other. One of the reasons this is according to the data and what we can highlight in accordance to this conference theme, centering the role of nurses and midwives in combating Black maternal health disparities, is the number of providers in maternal health that we have in the US compared to other high-income industrialized countries. When you look at this figure, you can see that we have a total of 15 per 1,000 live births, 11 OBGYNs, and 4 midwives per 1,000 live births. This is outrageous. And if we look at other countries such as Sweden, such as the UK, they have 43 midwives per 1,000 live births. And that's why their maternal mortality rate is 6 compared to our 24 just in 2020. Exactly, it says a lot. And so we're going to talk about our lab, which is centered, as Dr. Ayo said, to combat these disparities through advocacy, through mentorship. And that's why we call our lab the MOTHERLab. We are the Maternal Outcomes for Translational Health Equity and Research Lab. We are structured into 3 committees: the Research and Grants Committee, the Community Engagement Policy Committee, as well as the Marketing and Communications Committee. Though our committees all have each individual projects and responsibilities, we always make sure to cross-collaborate between our committees on several projects, as well as terms for collaboration between our committees in order to promote diversity and keep up-to-date information on current maternal health trends. As Dr. Ayo mentioned in the beginning, our mission is to address and eradicate inequities faced by Black populations and birthing people. And our vision is we want a world where BIPOC people, specifically Black birthing people, can go into a hospital, they can give birth, they don't have to feel less than due to systemic racism, due to homophobia, due to white supremacy, and that they feel healthy and secure in the birthing process.
So the Research and Grants Committee really focuses on curating and preparing the next generation of maternal health scholars. And as Subecha stated, we really work kind of across committees, but also within our committee, learn from each other sort of intergenerationally. So we have everyone from undergrads to MDs to PhDs, all collaborating, all learning from one another. And we really focus on applying for grant funding to really support this work, as well as working together on numerous projects, which I'll get into on the next slide. To really kind of highlight these issues, but also offer suggestions for improving and alleviating these disparities. So some of our most recent projects have focused on maternal mental health, and we've really been looking at the impacts of systemic racism, but also of other socioeconomic factors that really come into play and are really driving these disparities. We are also focusing on really getting to the root cause of a lot of these disparities through the policy lens, which we've seen huge shifts in maternal and reproductive health policy in the U.S. over the past few months even, and really, getting to the historic roots of this, but also understanding what steps we need to take to hopefully improve these outcomes. So we're really excited about these projects and are constantly taking on new ideas and new questions.
The next committee we would like to highlight is the Marketing Communications Committee, which I'm lucky enough to be part of. It's focused on disseminating all information the MOTHERLab comes out with, our research, our presentations, blog posts. We have thousands of followers on all our social media. You should follow if you're interested to hear more about our research and our events that we have. In 2022, we had an annual report, as you can see on the screen. So sorry about that. We had an annual report. We reached 1,000 followers on multiple of our social media platforms and got into the couple thousand on Instagram and Twitter. We pushed new research. We had plenty of publications last year, so we got to push that out to the local community. We launched the Nurture Kit initiative, and in the past month, we had an aftershock viewing, which was a great success that we were super excited about.
The Community Engagement Advocacy and Policy Committee are responsible for connecting with community organizations. By community organizations, we mean where our MOTHERLab members are based. We're a national lab, so there are a majority in here located in Boston, but there are also many located in Texas, in Tennessee. So any local organizations that our members want to take the initiative and connect with are the role of this committee, as well as keeping up to date on maternal health policy. Next slide, please. Some specific examples of projects that have been done by the Community Engagement Committee are, if you look on the right and left side, are two policy newsletters. Back in early 2022, when there was obviously reproductive health rights issues regarding the reversal of Roe v. Wade, our Community Engagement Committee created a policy newsletter highlighting different case studies that required and basically constitutionally safeguarded the right to abortion as well as other reproductive health measures. And this policy newsletter taught me a lot about the history of reproductive rights in the U.S. And then the one on the my left is about the lack of nutrition in different states in the United States that have food insecurities that are specifically targeting pregnant people of color. In the middle is the initiative Lily talked about, the Nurture Kits initiative, and pictured is one of the committee members, Liz. And on the bottom is the MOTHERLab podcast, which currently has 7 episodes led by Ameo, the co-chair of this committee. These podcasts are amazing. They feature Dr. Ao, some of our members of the MOTHERLab, and feature also people who are doing the work, such as abortion providers, Dr. Khan and Dr. Lockley from New Mexico and New York City, who are in the midst of facing the repercussions of the Roe v. Wade reversal and Dobbs decision. They also feature lactation specialists, doula providers, the whole set of maternal health is in this podcast, and I highly recommend you listen to it.
And now, my favorite part are all the branch organizations of the MOTHERLab, which I think are very unique and which we'll get into the next slide. So one of them is the Maternal and Child Health Journal Club, which is based here at the Tufts Med campus. And we really focus on really getting well-oriented in the maternal health literature and meet monthly, with different themes each month and each semester. So pictured here are a few guest speakers that we've had. Ave, who presented on her research. We've also had events where, current med students or, young researchers are able to really showcase their projects. So we focus on both published research as well as research currently in the works, and highly recommend that you sign up to our e-list to join. We do meet on Zoom, so wherever you are, you can join. Highly recommend.
The next thing we're going to talk about is March, which is an undergraduate club at Tufts University. It's the first undergraduate club at Tufts University focusing on maternal advocacy, and the first club in the country focusing on maternal health advocacy. So it was started by Siwar in 2022. She's amazing. Now she serves as our senior advisor, and Tia from programming and I are co-presidents for March. So essentially what we do is we have weekly meetings where we connect with members of the undergraduate community to talk about current maternal health issues and current statistics in maternal mortality. We work with a local nonprofit called Summer Baby, which is an amazing organization. I recommend looking into it if you haven't heard of it. It's an organization that provides education and a baby basket to every newborn baby in the city of Somerville. So we work with them, do collaboration projects such as putting up posters we design for them to help educate the Somerville community, or doing diaper drives. We also raise awareness for maternal health in our school community through tabling. We have trivia nights. We also do movie screenings like we did for Aftershock last fall. So it's an amazing organization. We're so thankful for Siwar for starting it. And it's a community that I love being a part of, and it's so inspiring to see so many undergraduate students so passionate about maternal health. And it helps me be super optimistic about our future, because I know personally there's like 60 members at Tufts who want to make a difference.
Talking about members of Tufts, this was a course that I started last fall. I got the opportunity to teach a maternal health focused class that first year students signed up for. This was inspired by all of the experiences I've had at the MOTHERLab and the Center for Black Maternal Health and Reproductive Justice, as well as any other maternal health experiences, this conference that I've been lucky enough to support and be a part of for the last three years. So this course was kind of an accumulation of everything that I've done in maternal health, and I wanted a way to summarize the biggest problems and figure out solutions with people who probably never heard about the maternal health crisis. And I just loved this course so much. Some final projects I wanted to highlight is one, Our Moms Are Dying graphic. One of my students, Anya, she created a Zine, which is a virtual kind of magazine, where she summarized all of the maternal health statistics and kind of put the maternal health crisis into simple terms, as well as highlighted key terms like maternal morbidity, maternal mortality, and these were kind of ideas that were influenced by her friends and people from the Tufts undergraduate community who had never heard of the crisis. I pictured here is my class basically going to the Designing Motherhood exhibit in Boston, where we were introduced to a lot of aspects of maternal health, maternal mental health, maternal reproductive health, and how it looked throughout the course of American and kind of global history. This influenced two of the students pictured, Remy and Emily, who is part of March, as well as is a volunteer for the conference today, to create a project where they gave the class simulations of different maternal health positions and the positions birthing people are part of. The one that I got was I had to put myself in the shoes of a trans father who is currently pregnant, who wanted to travel approximately 100 miles to receive gender-affirming health care for their pregnancy, or continue to go to a clinic that had not provided this gender-affirming care. And the way they wrote these narratives of people were both fictionalized by them as well as people who they knew. And I thought it was an incredible way to kind of, as someone who's doing the research or doing the advocacy work, to kind of think about, okay, these are the statistics, but these are also real life people, and real life people go through these. And I think this influences all Lily, Siwar, and I to continue doing this work, but everybody in this room as well, just to think about, like, we're personal people. We have people with stories, and it really came back to me that the work that we do is for the people. It's not just for the publications or the research, or conferences like these are great to meet other people, but it's for the people who are going through these issues. Oh, thank you. some of the future directions for our lab is we hope to continue cross-collaborating between our committees to continue identifying and disseminating information regarding maternal mortality and morbidity in the US as well as globally. We also hope to continue to incorporate the reproductive justice framework in everything that we do, whether it be conferences like this, publications, or events that we run. And we hope to advocate and continue to advocate in multiple of our platforms, as well as some research to advocate for the expansion of Medicaid to include doula care. As we might have heard in our previous conference revolving around the role of doula care in combating Black maternal health disparities, doula care helps. It prevents birthing complications that Black mothers particularly face in general hospitalized settings. And we did a research project last year regarding this, as well as presented this topic at the APHA last year. And we want to continue advocating for this because this will make like a huge, profound policy change. And our last one is really the reason why this lab started. We hope to continue to support and foster maternal health scholars and academics to become health professionals or research professionals in the maternal health field, because this truly will continue throughout the generations, eradicate the maternal health disparities we see today.
And we hope that you stay in touch with us. As Subacha said, that this is not the end. This conference is not the end of these discussions and conversations. So please, feel free to contact us, visit our websites, and on the following slide, we have our different social media platforms. So please feel free to connect to stay up to date. And thank you so much for listening to us today.
Does anyone have any questions for us?
Thank you, MOTHERLab. That was amazing. Can you talk about the Nurture Kits initiative that we're currently raising funds for? Thank you.
Yes, great question. We would love to. So the Nurture Kits are, self-explanatory. They're kits that provide really essential resources to mothers and really high-quality resources as well. So everything from breast pumps to diapers to baby essentials and necessities. And we're really hoping to fundraise to provide these kits to really provide these essential resources that are also sustainable and last long. So, for example, with the pumps, really reusable and can be, make a huge difference in the lives of these new parents and new families. So we really recommend that you support us in this initiative. It's not over. We're trying to fundraise, I believe, approximately $20,000 for these kits. So any dent that we can make in that would be amazing. So we really would appreciate your support.
Thank you. And did you say that there's a QR code on the back of the program? Wow. Oh, wonderful. Thank you so much.
Yes, so we have a question from the virtual audience. One was, how do you recommend universities develop a program like March or MOTHERLab?
That is a great question. And that's one that we really reflect on at March because it is a huge undertaking. And we're so grateful to have faculty like Dr. Ayo, like the MOTHERLab that are able to support us. We believe the first step is to simply find people with a passion to make a difference in maternal health outcomes. So you don't need 3 to 4 committees or 60 plus members or really, a huge sum of funding to do this work. All you need are a couple students who are interested and a local group or a local project that you can take on. So with Summer Baby, for example, Summer Baby is through Somerville Public Schools, and they provide resources to new parents, but also English language support to immigrants in the area, and all these other supports that may not be maternal health related directly, but that certainly impact mothers and parents. So I believe that, the first step is to find an audience, find people who would like to help you out, and then find a gap and fill it. And it's great to have resources like the Tufts Med Campus and the MOTHERLab, but if you don't, that's totally fine. You can still do this work, and also our doors are open as well. We'd love to support you. So if you're a student out there and would like to do something similar, please message us on Instagram, please reach out, and we'd be more than happy to collaborate with you as well.
Amazing job, you guys. So proud. Can you just give us a little bit more, could you provide a little bit more data about the numbers you're getting on social media and how they're trending? And also, what is aftershock? You mentioned aftershock, and I wonder if that's something you could explain.
I'll start with the social media question. So our lab was founded in 2020. So since then, we've had a sharp increase in followers. Specifically last year, we had a huge boom in social media. And for people visiting our websites and other publications, sorry, I think last year alone, we had around 25,000 views on our website, which is super exciting. And I think we gained around 1,000 followers on Instagram last year as well. So we've had a big increase, especially since we started, and it's only growing faster and faster as time goes on. And then our Aftershock screening. Aftershock is a documentary that follows the lives of families affected with maternal mortality, Black families affected by maternal mortality in the United States. So it interviews many families. You get to see the personal lives, the aftershock of the maternal mortality. So we had a screening for that in February.
You can watch it on Hulu. It's still available on Hulu, which is a media platform, yes.
Yes.
Hi, everybody. My name is Jay Wilson. I'm the founder of Melanated Moms. I wanted to know, how can other community-based organizations be involved or participate in some of the work that you all are doing?
On our website, we have a form, which is get involved with us, or if you go on our website, it says contact us. There is a specific form that the Community Engagement Committee created to branch out to other community organizations that are interested in working with the lab, specifically with the committee. There's a form, and there's kind of questions that highlight what kind of projects you would want to do or what kind of work that we can support your organization in. So that would be the number one way.
And I'll add to that briefly. Also, the Research and Grants Committee is always looking for communities to support if they need research support, which we understand sometimes can be a huge undertaking with dealing with data, understanding the data, knowing what to do with it. So we also support organizations in that. So to that end as well, feel free to reach out to Research and Grants, and we'd be more than happy to support with any data collection that would be helpful to your organization, or if you have the data, what to do with it.
And with marketing as well. With marketing as well, we love to hear from community organizations. We have a blog on our website. Right now we're working with a smaller lab at the University of Maryland, and we're doing a little spotlight on them. So we'd love to talk about organizations working towards this cause as well. And we would also always welcome collaborations on social media, whether that be live streams, posts we're collaborating with. We'll share things your community program is doing. So really reach out to anyone, and we'd love to work with you.
I believe there's also an email specifically, since the MOTHERLab is now housed in the Center for Black Maternal Health and Reproductive Justice. It's blackmaternalhealth@tufts.edu. Thank you.